We have developed frozen shoulder, ma'am. First, there are two issues. I will come one by one. First is that we have developed frozen shoulder. Frozen shoulder means that your capsule is tight. What do you mean by capsule? That if I see this image, and this is a normal capsule, you can see. Every joint has a capsule covering to prevent the joint fluid from leaking outside. Shoulder, knee, everything has a capsule covering. And this is elastic. It's stretchable. That's why I'm able to move my hand, right? Because it is stretchable. Once, if we want everything to be highly stretchable all of the life, right? Then we have to do some stretchings every day. Not every day, maybe every week is also good. Then the shoulder stretching once in a week from a younger age can prevent a frozen shoulder. You are doing stretches for yoga, some injury happened, and then after you stopped the stretching. That's how it happened. What I am saying, we have to do stretching once in a week all of our life. Whether we got an injury, we don't get an injury, we have to do rehabilitation after the injury, right? These stretching are highly specific. Maybe you don't know about them, all of the stretchings. Because these stretchings has been told by a sports physiotherapist. If you have been to a sports physiotherapist, they will tell you what stretching. Otherwise, you might miss some of the stretching. So now the capsule has become like this. It was elastic. Now after the injury, we have stopped stretching. We were not moving the shoulder. It became stiff. For frozen shoulder, the only treatment is that we have to again stretch it. If you want, we can meet the sports physiotherapist in the team and they will tell you some stretching and you keep on doing those stretching every day. You had a ligament here. You didn't do anything. It is not moving up now. So you have developed frozen shoulder. Why? Because after the injury, you are not doing anything. So we have to do manual stretching to get the range of motion back. Forget about the ligament. It will not increase. If you want to ask me, the ligament here will not increase with the stretchings. Stretchings will be highly specific according to your frozen shoulder. So we'll teach you exercises and it might be painful. Why? Because it is freeze now. So they have to push. If you can treat your frozen shoulder, we are very happy by yourself. It might not be possible because it can be very painful, right? So if you have tried it before, then you can try it again. First thing, with the stretching, always there is a component of strengthening as well, of rotator strengthening. Simple procedure that I will put a arthroscope in your shoulder and I will cut the capsule and you will be free again. Then maintaining this will be very easy after the surgery. If you don't achieve, then only. We'll give you a full trial of, okay, you do this stretching, you do this strengthening, you do it every day. If you achieve it, very good. If you don't achieve it, then we will put an arthroscope into your shoulder, we'll cut the capsule and we will achieve the full range of motion on day one. Then you have to do rehabilitation for 3 months, 3 to 4 months to maintain the range of motion and to get the strength back. Second, your tendon tear. So we have subscapularis tendon tear. This is the tendon which is got torn. This is the tendon which got torn. This is a broad tendon. Okay. The function of subscapularis is to give internal rotation. If I operate on this tendon, we will increase your frozen shoulder. Why? Because after this procedure, see, these procedures are advisable in younger people and a sports person. Like the subscapularis is torn, then we'll fix the subscapularis with knotless fashion. Again, this we have again stitched it.
Low profile.
But after I stitch the subscapularis, we have to immobilize shoulder for around 1 month. So if after the procedure, if I don't move the shoulder, frozen shoulder will increase, which you don't want. So we leave this tendon as it is. Don't do anything.